Hello everyone, my name is Linda Obin Eji, and this is my practicum experience video presentation. The following are the outline of my presentation. 1. Practicum purpose. 2. Practical knowledge and insight. 3. Lessons learned. 4. Unanticipated challenges. 5. Things I would do differently next time. And 6, which is the last one, is the overall experience. Purpose of the practicum. Liberty University held 698A practicum experience course with a total required hours of 120 and above under the instruction of a certified public health professional or a Master of Public Health holder. Is designed to help students gain exposure to real-world global health issues, proficiency on addressing those issues with reference to acceptable federal, state, local, and internationally accepted protocols. Practical knowledge. So with the practical knowledge, I have stakeholder engagement. So I engage by engaging with various stakeholders such as community leaders, community members, teachers, non-governmental organizations, healthcare professionals, reveal the importance of effective communication and collaboration. Data collection and analysis. I gained experience in collecting data, analyzing and interpreting data to inform decisions and strategies. Problem-solving techniques. By the help of the preceptor, I have gained insight and proficiency to identify problems, explore solutions, and implement strategies to overcome obstacles. And then the last one is contextual understanding. I have gained an understanding of the real-world context in which my field operates. This includes cultural, social, economic, and environmental factors that impact the health of a public and becomes a hindrance to achieving holistic health, such as political interest. Lessons learned. I learned lots of lessons from this practicum, and I came out with the following lessons. One is how to enter a community. To be supported by the community, appropriate protocols have to be addressed for the community's support, such as the chiefs and opinion leaders. Understanding system dynamics was another lesson that I learned. Practicums offers a chance to observe how systems and organizations operate, giving you insight into the broader context of your field. I also learned how to broaden my interpersonal skills. Working with diverse stakeholders, clients, or community members honed my interpersonal skills, such as communicating, active listening, empathy, and collaboration. And then I also learned cultural competency. Since there were diverse communities and different opinions from the leaders, I quickly learned to appreciate and respect the different cultures, norms, and their perspectives on how to address issues. And lastly, advocacy was the last lesson that I learned. This practicum have improved my skills in how to advocate by selling the problem through justifiable means and feasible routes as to use of data, from the clinics and best practices from the literatures. Unanticipated challenges. There were a lot of challenges during the practicum, and I came out with the following. Internet or network challenges. Internet services in Ghana is not fluid as in America. Therefore, most of the meetings was a struggle to get in. Secondly, difficulty in reaching all the key stakeholders. Since lack of potable water is a political and sensitive issue, most of the key stakeholders did not want to participate. Thirdly, behavior change. It is taking time for most of the community members to adhere to best practices such as protection of the water bodies and stop of illegal mining, which has a negative effect of water quality. And lastly, lack of information. Information that are factors to lack of potable waters for Upper Dentra West were denied. Things that I would do differently next time. One is I will adapt to unexpected challenges. I will better anticipate and handle unforeseen obstacles that may arise during such study process. 2. Time management. That is one of the things that I'm going to do next time differently. I will allocate schedule and time differently to ensure a more balanced and effective approach to research activities due to time difference. Interpretation of findings. I will approach the interpretation of the practicum findings differently to draw more nuanced and insightful conclusions and consider alternative explanations for the results to enhance the depth of analysis. And then lastly, physically present. Physically, I will advocate for funds and be present at the site of data collection to draw a strong representation of the situation, engage the communities physically, and take a virtual and foster a strong with conditions and stakeholders. In total, I have gained a lot of experience, and these are my overall experiences that I gained from the practicum. One is data collection and analysis. 2. Stakeholder engagement. 3. Teamwork. 4. Advocacy. 5. Cultural competence. 6. How real-world factors that affect public health. And lastly, health education and promotion.